New tonight at 5:30, we have new insight into the opioid epidemic right here in Western New York. Yesterday, we told you about a new CDC report that showed a decrease in opioid prescriptions nationwide. It was somewhat good news. Well, today we obtained data specifically for Western New York, including one county that's been hit hard. Channel 2's Michael Wooten is digging deeper tonight. Michael.
Kelly, the good news here is that every county in Western New York saw a decline in the number of opioids prescribed from 2010 to 2015, but there's still plenty in this new report that should alarm all of us.
Opioids are still being prescribed and consumed at dangerous levels, according to new numbers from the Centers for Disease Control and Prevention. As this nationwide map shows, Niagara County falls into an alarming category among those with the highest rates of opioids prescribed. In 2015, just shy of 1,000 morphine milligram equivalents, or MMEs, per person were filled at pharmacies in Niagara County.
But in the counties with the highest prescribing, there were higher concentrations of people who were unemployed or uninsured, whites, or people with diabetes, arthritis, or disability.
The CDC says opioids should not be prescribed for those suffering from long-term conditions like arthritis and back pain.
It's a challenge to try and overcome patients' perceptions that they need these opioid medicines to manage their pain.
The CDC also says doctors should be very cautious in prescribing opioids for acute pain, even for things like surgery and late-stage cancer. Always think about alternatives.
Things like a broken leg or things like a kidney stone don't always require opioids. There are things we can do that are just as effective.
Back in Niagara County, the opioid prescription crisis is getting better. From 2010 to 2015, there was a 22% decline. That mirrors much of the country. In 1999, there were 180 MMEs of opioids prescribed per person nationwide. The rate more than quadrupled to its peak in 2010. Then over the past 5 years, we've seen a 20% reduction. Good, but not enough.
This is the first glimmer of hope in the opioid epidemic, but we still have too many people getting too much for too long.
We're still seeing a rise in the number of deaths caused by opioids, much of that related to heroin, and experts say that often starts with these prescription pills. Michael Wooten, Channel 2 News.